Do you experience pain in your upper abdomen? Don't ignore it because it could be a sign that your pancreas is dying. In this video, we will look at many of the symptoms that indicate pancreatic problems. We will also learn what function the pancreas performs in our body and try to understand what happens if the pancreas is dying. In the final part of this video, we will tell you about some foods that will bring your dying pancreas back to life. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Let's start by briefly reviewing what function the pancreas performs in our body. The pancreas plays a key role in our body's digestive and endocrine systems. It primarily aids digestion by producing enzymes that help break down carbohydrates, proteins, and fats in the small intestine. It also regulates blood sugar levels by secreting the hormones insulin and glucagon, which are needed to keep blood glucose levels stable. Without a properly functioning pancreas, digestion and blood sugar regulation can become severely compromised, leading to a variety of health problems. What happens if your pancreas stops functioning? Let's find out. When your pancreas doesn't work or experiences dysfunction, it can lead to serious consequences for your overall health. Pancreatic insufficiency, characterized by an inability to produce enough digestive enzymes, can lead to pancreatic dysfunction. Nutrient absorption is impaired, resulting in weight loss, nutrient deficiencies, and gastrointestinal discomfort. Moreover, pancreatic diseases such as pancreatitis or pancreatic cancer can cause debilitating pain, jaundice, digestive disorders, and even life-threatening complications if left untreated. Therefore, recognizing the signs of pancreatic disease and seeking medical attention in a timely manner is crucial to treating and possibly reversing pancreatic dysfunction. Now let's talk about pancreatitis. Pancreatitis is a condition characterized by inflammation of the pancreas that can cause severe abdominal pain, nausea, vomiting, and in severe cases, organ damage. There are two main types of pancreatitis: acute pancreatitis and chronic pancreatitis. What is acute and chronic pancreatitis? Acute pancreatitis usually develops suddenly and is often triggered by factors such as gallstones, excessive alcohol consumption, certain medications, or infections. Symptoms of acute pancreatitis can range from mild discomfort to severe abdominal pain and may require hospitalization for treatment. On the other hand, chronic pancreatitis is a long-term condition characterized by constant inflammation and permanent damage to the pancreas. Chronic pancreatitis often develops gradually over time, usually due to long-term alcohol abuse or recurrent episodes of acute pancreatitis. Symptoms of chronic pancreatitis may include persistent abdominal pain, weight loss, diarrhea, and greasy stools due to impaired nutrient absorption. Both acute and chronic pancreatitis require medical intervention to relieve symptoms, prevent complications, and preserve pancreatic function. Treatment may include pain relief, dietary changes, taking enzymes, and in severe cases, surgery to clear blockages or remove damaged tissue. Early diagnosis and proactive treatment are essential to improve outcomes and quality of life for people with pancreatitis. What are the causes of pancreatitis? Pancreatitis, inflammation of the pancreas, can be caused by a variety of factors, but gallstones and excessive alcohol consumption are the main culprits. Gallstones can clog the pancreatic ducts, triggering inflammation and subsequent damage. Chronic alcohol abuse can chemically alter the pancreas, increasing the risk of inflammation. In addition, abdominal trauma, such as an accident, can trigger pancreatitis. Certain medications, including antibiotics and diuretics, can also trigger this condition. Elevated triglyceride levels in the blood are another risk factor, especially if they are extremely high. Infections such as mumps and autoimmune diseases, in which the body mistakenly attacks the pancreas, can also trigger inflammation. In addition, genetic predisposition can contribute to the development of pancreatitis. Certain mutations increase susceptibility. Now let's get to the main point: 10 symptoms that your pancreas is dying. Symptom number 1 is persistent abdominal pain. Constant abdominal pain, especially localized in the upper abdomen or radiating to the back, is a hallmark symptom of pancreatic dysfunction. The pancreas, located behind the stomach, is prone to inflammation and injury, which often manifests as a dull gnawing pain that may be worse after eating or lying down. In acute pancreatitis caused by factors such as gallstones, alcohol abuse, or trauma, the pain can be sudden and severe, requiring medical attention. Chronic pancreatitis, characterized by persistent inflammation and scarring of pancreatic tissue, can lead to periodic bouts of abdominal discomfort, sometimes accompanied by weight loss and digestive disorders. The pain associated with pancreatic dysfunction can be debilitating, affecting daily activities and quality of life. Symptom number 2. Digestive problems. Digestive problems including nausea, vomiting, diarrhea, and greasy, foul-smelling stools, steatorrhea, are common manifestations of pancreatic insufficiency and malabsorption. The pancreas produces digestive enzymes such as amylase, lipase, and protease, which are needed to break down carbohydrates, fats, and proteins in the small intestine. When the pancreas is compromised, either due to inflammation, obstruction, or enzyme deficiency, proper digestion is impaired, resulting in gastrointestinal symptoms. Nausea and vomiting may result from accumulation of undigested food in the stomach or from irritation of the digestive tract. Diarrhea, often fatty and voluminous, results from incomplete digestion of fats, leading to excess fat in the stool. Steatorrhea, characterized by loose, pale, and foul-smelling stools, indicates incomplete digestion and absorption of fats, resulting in the excretion of undigested fat molecules. If left untreated, these digestive disorders can lead to nutrient deficiencies, weight loss, and dehydration. Treatment usually includes enzyme replacement therapy and diet modification to improve digestion and relieve symptoms. Symptom number 3. Unexplained weight loss. Unexplained weight loss is an alarming symptom often associated with pancreatic dysfunction, especially in cases of chronic pancreatitis or pancreatic cancer. The pancreas plays a vital role in digestion, producing enzymes needed to break down food and facilitate the absorption of nutrients in the small intestine. When pancreatic function is compromised due to inflammation, obstruction, or impaired enzyme production, the body can have difficulty effectively absorbing essential nutrients. This malabsorption can lead to a caloric deficit despite adequate food intake, resulting in unwanted weight loss over time. In addition, metabolic changes associated with pancreatic disease, such as increased energy expenditure and altered hormone levels, may further contribute to weight loss. In the case of pancreatic cancer, the tumor may also produce substances that cause metabolic changes and promote weight loss. Symptom number 4. Jaundice. Jaundice, characterized by yellowing of the skin and eyes, is a clear sign of pancreatic dysfunction, especially if it is associated with bile duct obstruction. The pancreas produces digestive enzymes and bicarbonate, which enter the small intestine through the pancreatic duct. However, if the duct becomes blocked due to inflammation, gallstones, or a tumor, bilirubin produced by the liver can enter the bloodstream, leading to elevated levels of bilirubin, a yellow pigment formed when red blood cells break down. The buildup of bilirubin manifests as jaundice, which results in yellow staining of the skin, sclerae, whites of the eyes, and mucous membranes. Other associated symptoms may include dark urine, pale stools, itching, and abdominal pain. Prompt examination is needed to identify the underlying cause of jaundice, as it may indicate serious conditions such as pancreatic cancer, biliary tract obstruction, or liver disease. Treatment depends on the underlying cause and may include measures to remove bile duct obstruction, manage symptoms, and treat the underlying pancreatic disease. Symptom number 5. Changes in blood sugar levels. Blood sugar changes, characterized by fluctuations in glucose concentrations, can occur in people with pancreatic dysfunction, especially when insulin production or secretion is impaired. The pancreas plays a critical role in regulating blood sugar levels by producing insulin, a hormone that promotes the uptake of glucose by cells for energy utilization and storage. In diseases such as pancreatitis or pancreatic cancer, damage to pancreatic tissue or impaired insulin secretion can disrupt glucose homeostasis, resulting in hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. Symptoms of hypoglycemia can include increased thirst, frequent urination, fatigue, blurred vision, and slow wound healing. Hypoglycemia, on the other hand, can cause symptoms such as sweating, shivering, confusion, dizziness, and fainting. In people with pre-existing diabetes, pancreatic dysfunction can worsen glycemic control or make it difficult to control blood sugar levels. Careful monitoring of blood sugar levels and appropriate management strategies are essential to prevent complications and maintain optimal health in people with pancreatic dysfunction. Symptom number 6. Back pain. Back pain, especially in the upper abdomen radiating to the back, is a common symptom associated with pancreatic diseases, such as pancreatitis or pancreatic cancer. The pancreas is located behind the stomach, and inflammation or damage to this organ can cause back discomfort. In acute pancreatitis, back pain can be sudden and severe, while chronic pancreatitis can cause periodic bouts of dull, constant back pain. If back pain is persistent or severe, you should see a doctor, as it may indicate underlying pancreatic problems that require treatment. Symptom number 7. Digestive enzyme deficiency. Digestive enzyme deficiency is the hallmark of pancreatic dysfunction, especially in diseases such as chronic pancreatitis or pancreatic insufficiency. The pancreas produces enzymes such as amylase, lipase, and protease, which are essential for breaking down carbohydrates, fats, and proteins in the small intestine. When pancreatic function is compromised due to inflammation, obstruction, or enzyme deficiency, proper digestion is jeopardized. This can lead to symptoms such as abdominal bloating, abdominal discomfort, diarrhea, and incomplete absorption of nutrients. Treatment usually includes enzyme replacement therapy and dietary changes to improve digestion and relieve symptoms. Symptom number 8. Fever and chills. Fever and chills occur in acute pancreatitis or pancreatic infections, indicating an inflammatory response or systemic infection. Acute pancreatitis, often triggered by factors such as gallstones or alcohol consumption, can lead to localized inflammation of the pancreas accompanied by fever and chills. Pancreatic infections, although less common, can also cause similar symptoms. Fever is the body's natural response to infection or inflammation, and chills can accompany fever as the body tries to raise the temperature. A quick medical evaluation is needed to determine the underlying cause of the fever and chills and begin appropriate treatment. Symptom number 9. Abdominal bloating. Abdominal bloating, also known as abdominal distension, may be seen in people with pancreatic diseases such as pancreatitis or pancreatic cancer. Inflammation or fluid buildup around the pancreas can lead to abdominal bloating, which may be accompanied by discomfort or soreness. Pancreatitis, acute or chronic, can cause localized swelling due to inflammation of the pancreatic tissue. In the case of pancreatic cancer, a tumor in the pancreas or nearby organs may cause abdominal bloating as it grows. Symptom number 10. Changes in the color of urine or feces. Changes in the color of urine or feces may occur in people with pancreatic dysfunction, especially if they are associated with conditions such as pancreatic cancer, pancreatitis, or bile duct obstruction. Dark urine may be the result of elevated levels of bilirubin in the blood, indicating liver dysfunction or bile duct obstruction. Pale stool color, on the other hand, may indicate a decreased flow of bile into the intestine, resulting in stools lacking pigments formed from bilirubin. We are now going to tell you about 3 types of foods that will help you restore your pancreatic health. 1. Let's start with fatty fish, such as salmon, mackerel, and sardines. They are a valuable addition to a diet aimed at supporting pancreatic health and recovery due to their abundance of omega-3 fatty acids, which have powerful anti-inflammatory properties. These nutrients play a critical role in mitigating the chronic inflammation that characterizes pancreatic diseases, such as pancreatitis. In addition, The high protein content and rich array of essential nutrients, such as vitamin D and selenium, contribute to overall body health and strengthen immune function. 2. Leafy greens like spinach, kale, and cruciferous vegetables like broccoli and Brussels sprouts are equally healthy choices. Rich in antioxidants, vitamins, and fiber, they aid digestion, regulate blood sugar levels, and contain compounds such as sulforaphane and indole-3-carbinol, known for their anti-inflammatory and anti-cancer effects. 3. Finally, berries such as blueberries, strawberries, and raspberries are powerful sources of antioxidants, vitamins, and fiber, effectively fight oxidative stress and inflammation, regulate blood sugar levels, and aid digestion. Incorporating these nutrient-rich foods into your diet provides significant support for pancreatic health and recovery. If you have any questions, ask in the comments.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.